Hi, my name is Dr. Rudra and through the Oral Health channel today we're going to be talking about all-on-4 dental implants protocol. Let's start. So let me tell you, this video is not directed towards dental students or dentists. This video is directed towards the general population and the masses, and I'm going to just be talking about the all-on-4 dental implant protocol at a glance. I'm not going to go into the details. I will just talk about what are the advantages, what are the disadvantages, and who can benefit from these procedures. Now, we all know that with age, a lot of times the bone gets resorbed of patients who have lost their teeth, and sometimes their ridge, that means the alveolar ridge over which the denture sits, is very resorbed, and thereby they cannot wear the dentures. It's not possible for us to plan complete denture, that is removable complete dentures for these patients. Anyway, but there is something known as an all-on-4 dental implant protocol, which is basically using four dental implants in the front side of or the anterior region of your upper and lower bone. Thereby they can support a prosthesis that can help you eat, right? So basically, how did this concept come about? It was talked about that you can go for surgical treatment of implants. You don't need a lot of implants for the full mouth rehabilitation. You can do it in 4 implants, 2 anteriorly placed implants which are vertical and 2 distally angulated implants, and the same thing in the lower things. Why the angulation? First of all, the bone in the anterior region is much better and dense. Secondly, you have the maxillary sinus, a vital structure which can get perforated and cause complications, and you have the mental foramen here. So in order to spare these vital structures, we angulate the posterior implant. So why the angulation? It is to spare the maxillary sinus and the mental foramen. I'm not going to go into the case selection details, but it has its own advantages. It is a less complex surgery. On top of that, you end up saving a lot more money than spending it on a lot of implants. It is relatively less risky in terms of the vital structures because they're avoided. Now, the surgical protocol is basically you start off with the surgical case planning. That's very important, and this is the most crucial step because that's where we decide that if you are a candidate fit for this procedure or not. And the surgical procedure can be carried out under LA or GA depending upon the case selection. We also fabricate an all-on-4 dental implant guide, a prefabricated guide which helps us locate the vital structures and the precise location where the implants have to be placed. Now, once we do that, we've done all this planning, we've fabricated the guide with the help of CAD/CAM technology. If there are any teeth present, we go for the extractions under LA and GA or GA, and then we open up the gums surgically to localize the area, and then we place the implants, 2 anteriorly which are vertical and 2 distally which is angulated from an angle of 30 to 45 degrees depending upon the case. We place 4 implants in the above and 4 implants below, and then we give you temporary provisional restorations, and then we close it up and we let you heal for some time. That is about 4 to 6 months, and we make sure that these temporaries are comfortable and you can eat your food with them and those things, and we tighten these temporaries. Now, once these things are done, we take your interocclusal records, we fabricate wax patterns, resin patterns. The prosthetic part is very complicated, so I'm not going to go into the details. After the temporary placement, we first take your bite registration. We do the CAD/CAM scan by mounting your the acrylic bars and wires, whatever prosthesis, the interim prosthesis that we have, on a model, and then we fabricate the resin patterns, and then we do a metal try-in after that, and then we finally fabricate your final dentures, and then we put them permanently. Now, the added advantages I've already talked about. The only disadvantages to this procedure is that it is very technique sensitive, it is very case sensitive, and you definitely do require, it's most likely that you require a prefabricated implant guide so that you place the implants in the right position. The case selection is the most important, and definitely the one who is placing the implants on you has to be very technically sound. It requires a technical know-how knowledge of the implantologist who has been placing these implants in you. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message with your name, your place, and the common oral health problem that's giving you discomfort, and you can drop me a message on WhatsApp. We can have a talk. I'll probably message you after a few days. And if you have any queries, doubts, apprehensions and insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.